Thanks everyone for joining us today. We are going to be talking about the Small Business Benefits Index that Vitable Health put together back in October. So we're excited to run through that. Today's host is our Chief Revenue Officer, Brendan Mullins. He's had a over 20-year illustrious career building revenue teams and partnerships in the health and benefit space. And he's held CRO and VP sales roles at TriNet, Silk Road Technology, and Doma. So we're excited to have him join and host and cover all the great data points that we were able to collect in this year's Small Business Benefits Index. So um, thank you, Brennan, for joining us today. And I do want to say if you have any questions throughout, please enter those through our chat function, and then we will cover them as we get to the end of this presentation.
Amazing. Okay, but who are you?
Oh, yes. My name is Catherine Torres. I am our head of demand generation here at Vitable Health, and I have some experience in the health benefits space as well, primarily marketing a concept called the individual coverage health reimbursement arrangement. So I really enjoy making health benefits more accessible to employers who are underserved in today's market. And that is exactly what we're going to be focused on today, on how traditional options do not typically serve small organizations or their employees the way that they need to be served. And so, yeah, excited to join
Awesome.
you as well.
Great. Catherine, thank you so much. Like Catherine said, I'm Brendan Mullins. I'm the Chief Revenue Officer at Vitable Health. I have been in the health and benefit space for, gosh, probably 20 years of my career at this point, and joined Vitable because of our mission. Working with small businesses for as long as I have, I saw that one of the most taxing and problematic parts of running those businesses was trying to figure out a couple things. One was retaining employees, but two was also related to that, which was just trying to understand, how do I provide people some kind of healthcare at the end of the day? And that I empathize with all of you strongly. It is very tough. As we head into 2026, we have seen, gosh, just incredible increases to premiums, to healthcare cost, and what you end up dealing with on a day-to-day basis is very difficult. So today we'll talk about what we see as far as state of the world, what 2026 looks like. We'll talk about solutions to that, and as you have questions, I think Catherine, do we have chat? Can they pop in questions or?
Yes, we do have webinar chat enabled. So if you enter a message into the chat, we can respond.
Awesome. All right, so let's get started. Um, we'll start just by kind of giving the general overview. There's about 35 million SMBs in the United States. And when you think about the bulk of workers that are tied in, that's about 60 million people. Or if you think about it in America, what's that? Basically a fifth of the entire population are working in small businesses. When you think about traditional health insurance, those group health plans that are so popular, a lot of these are built for very large employers. And unfortunately, there is this divide for workers that kind of get left in what I would say is the ether out there. You can see down below, this is our founder, Joe Katonga. And Joe's story is really interesting. He came here from Kenya when he was about 13. His parents bought a home health care and they opened it and he worked in it. He basically lived in it for his teen years and saw that the people employed by his parents' home health care, hourly workers, they were making not enough money really to buy into the company's group health plan, but then they were making too much to go and get like full subsidies from Medicaid and the government and all that. And he realized that there was just this, no man's land where people ended up, not having access to healthcare because they were just kind of stuck in this weird place. And every dollar they received, it became a question of like, do I want to pay rent? Do I want to, feed my family? Or do I want to go buy healthcare, which I desperately need, but might not need right now? And so that's why he created Vitable. And when you think about, what we are targeting, it's really a lot of that hourly population. It's a lot of people that are just trying to, get by day to day, but still be able to provide some very strong healthcare for their family, right? It's something we deserve. And we in October put together the survey through YouGov. We went out, we surveyed about 768 employees, over 510 employers, and just really dove deep into, what are you doing with healthcare? What does this look like? What are you struggling with? Just a lot of questions that would really give us good and strong insight to be able to feed back to, our employee population and also really anybody that had that interest. So what did we learn? When you think about your teams and who you're employing, what we learned about, it's not really about availability for these people. It is mainly about affordability. And this is probably not going to come as any kind of shock to you, right? Health benefits are expensive. They are often last on the list of what people are going to go spend their money on because they, like I said, have other critical expenses. And when we looked at what that translates into as far as what do they do with their own care, well, you can imagine that a large majority of these people are skipping or postponing care. In fact, 40% of small business workers skipped or postponed care last year due to cost. When we see people enrolled in high deductible plans, they're even more likely to delay or skip that care. And what we can see is them enrolling in that high deductible is an indicator that they want health insurance, but they're really concerned about the cost, right? So what's coming out of their paycheck every other week or twice a month is a lower cost, but when they go and use it, that high deductible kicks in. And if they have not contributed to the HSA that might be attached to it, they're going to be paying a lot out of pocket. And what we also saw, and this is really interesting, is that productivity suffers from poor access. Meaning, you might have employees that are battling chronic illness, chronic disease, things like hypertension, diabetes, asthma that become, a day-to-day problem they have to deal with, and without proper treatment can really drain them and allow them to be a lot less productive. We saw that small business employees lose nearly about one full work week of productivity each year. And what we also saw is it's not even necessarily that employee, it can be tied to their family. So you think about maybe a single mother who is, working an hourly job, has kids at home, and they're sick. And what happens when they now have to call out? They now have to go take care of it. They might lose that day of pay, and you're losing that productivity as an employer. It becomes this kind of, circle of pain, I would almost call it. And so US employers overall lost about $36 billion in workdays from sickness, chronic disease, and all of these pieces that we're talking about. And so when you put that together and you think about, okay, what are some of these solutions? Well, we realize pretty quickly that preventative care is the best thing people can do. And if you have ever worked for a very large employer, a lot of them will put together programs and say like, hey, we're going to go and, we're going to give you $50 to go buy a gym membership or $50 to buy a pair of workout sneakers or all of these different incentives. We're going to, do a stair walking competition across the company. That's not out of the kindness of their heart. What they're realizing is if we can get people healthier on the front end, we know that we won't have as many claims in our insurance. And when you think about from the SMB standpoint, obviously a lot harder to do those things. You don't have the time, the money, or really the population size to make a big impact. But what you can do is try to drive people to go and get their preventative care. Those doctor's visits, medications that help them, all that stuff ahead of time before something serious actually happens. About 66.5%, you can see here, of employees had an annual checkup last year. And 30% of those 66 completed recommending screenings. I know I'm guilty of this myself, right? Where I go to the doctor, I get my preventative care. They say, you got to go do this blood work. I say, oh my gosh, okay, no problem. I'll figure out when to do that. It drags on and on and on. And then all of a sudden I'm looking for that sheet months later. Like I know I've got to get this done. If somebody had me on a schedule, that would probably be a lot more helpful. And what we see is that the other part is this can really influence retention. It can be a recruiting tool but it can also keep people on board once you have them. What we saw in a SHRM survey was that 68% of employees said that health insurance was a key retention benefit. No shocker here, but there is a exchange rate here, right? 44% of workers would choose reliable coverage over a 50 cent per hour pay increase. Depending on money versus care, that kind of does like this flip flop. But around that 50 cents an hour, they do believe that it is worth it to go get that coverage over the money because they know at the end of the day, they'll probably spend that money on healthcare anyway. So your world right now, currently, state of small business benefits. We now have employer-sponsored family premiums are now exceeding $27,000 a year. That is massive. Half of private sector employees are working in small businesses. And unfortunately, these workers make up a disproportionate share of the uninsured. Right now, if you are under 50 employees, you do not have to supply healthcare. If you're not a applicable large employer. And that obviously can trickle down to small businesses. A lot of small business owners want to supply healthcare. They might just not be able to afford doing so. And a lot of these employees, if they choose, will then go out and buy healthcare on the open market in an exchange. But often what we see is patchy kind of enrollment. It's on and off. It is choosing low value plans, and it really turns into something that's not beneficial for anybody at the end of the day. An example we can use here is Marcus. Marcus is a plant manager. He is insured, and like I said, technically, right, he has insurance. His employer does what they can. They offer that high deductible plan, which he invests in. But with that high deductible plan, he has, let's say, a $2,000 deductible. Every time he goes to the doctor, I'm sure a lot of us can empathize with this. He gets bills after. He has no idea what they were for. He thought it was covered. He is, fighting back and forth with the insurance company. And every visit feels like a bill he can't predict. So you can imagine what happens. Marcus stops going. And so even though there's a primary care clinic 10 minutes from his house, he doesn't go. Last year, Marcus felt chest tightness, fatigue, shortness of breath, nothing severe enough for the ER, but concerning. And the result was he didn't go. He waited. Not because of access, but it was that fear of the unknown of that cost. And he, thinking about going there, and imagine you as small business owners, imagine somebody walked into your store and said, how much is store, business, whatever it is, how much is this? And you say, I don't know, but I'll send you a bill later for it and we'll see how it turns out. It's one of those things that in healthcare, that's how we operate, right? Ask them for a price, they don't know. That's why he doesn't go. He doesn't know what that cost is going to be. And weeks later, the symptoms worsened. He ended up in urgent care. It cost him a full day's wages, and he still didn't get to the root cause. What we see is without that consistent preventative care or the monitoring of conditions like a diabetes, like heart conditions, like things like that, weight management, all of these, people wait and then it gets worse and they end up spending more money at the end of the day because they run to the emergency room. Handled earlier with better plan, it costs them less. The employer has less time forfeited from that employee for work because they're ahead of it. They're not dealing with it urgently. It benefits everybody across the board. I don't know if this scenario sounds familiar to you, but it's very, very common in the world that we work in. And so, again, going back to the why, I love this line. It's actually a very sad line. Behind every skipped appointment is a person choosing between health and financial stability. And this, unfortunately, is the state of a lot of our hourly workers in SMB. 7% of them lack coverage entirely. 23% skipped or delayed care multiple times. And just about 40% of them have skipped or delayed care this year. Some of it, yes, they don't want to take time off work. The other part of it is they just don't know what it's going to cost. And they're terrified they're going to get that bill in the mail that is way out of budget. Quick story. I had a large bill come in the mail, a couple of months back. I didn't think it was right. I called the facility that did it, and they said something along the lines of, well, what could you pay? And I was sitting on the line going, I don't understand. What could I pay? Well, what is the cost? And they said, well, if you pay today, we'd be happy to take 25% off of this. And I sat there shocked thinking, okay, am I buying a used car? Right? This is my healthcare. This is my personal, safety. And the idea that the bill was negotiable was just shocking to me. And you can imagine how this translates into people skipping care. They don't believe the cost is right. They don't understand what it's for, and they don't want to take the time off work to do it. So again, those financial barriers really force workers to postpone routine visits. Simple issues will escalate, and then they end up in the ER. 8.2% will default to the ER in most situations. For any of you that have taken a visit to the ER, you know what that costs. It is extremely expensive, and without insurance, it's a massive problem. I've taken my kids to the ER. I had young kids. One visit to the ER, I'll never forget. I got the bill back. I had insurance at the time. The bill was about $40,000 pre-insurance. And keep in mind that $40,000, what it really is a negotiating point between the insurance company and the hospital. It's where they start on negotiation. And then they negotiate down. Luckily, I had insurance and I paid $1,000, $1,500 or something like that. But for the person that doesn't and ends up in the ER, even though that's a negotiating point to start with, they're on the hook for that $40,000, which is crazy. And so when those people end up going to the ER, it creates a whole disaster scenario, especially if they don't have insurance. 32% of them rely on urgent care for non-emergencies, which is better, but still, if you can get ahead and work on those chronic conditions, it really just saves everybody a bunch of time and money. That preventative care will also, translate into about 24% to 33% fewer illness-related missed days, which is great. And like we said, this costs U.S. employers about $575 billion in absenteeism and $1.5 billion in productivity costs. And not, like I said, just for that employee, it's also whatever is going on with that employee's dependents and what they need to do for that day to take care of people and their family. When you think about preventative care and you get the state of where are we with utilization, you have about 66.5% of people who've had their annual checkup. Good to all of you who've done that this year. You get about just shy of 38% of people have received vaccines, and you've got about 30% of people that have completed screenings. There are 14% of employees who haven't seen a doctor in over a year. That's a pretty significant number. And I would liken it to, like repairs on your house, right? If you ever notice, like there's maybe like a spot in a wall or a ceiling, and then that starts to grow and grow and grow. What I've learned over time is these things do not get better. And it's the same as you physically, right? So the more you put it off, the more expensive it's going to be, the more dangerous it is, and just becomes a massive problem. What we also see is employers believing they're delivering benefits and doing the right thing, but employees saying they still can't afford it. And that's a really interesting divide. It's a really interesting place to be. You, as a small business employer, you think you're doing the right thing. You go out there, you say, oh my God, so happy. I'm really proud, honestly. We hear proud is a big word. I'm really proud I can go and deliver benefits to my employees. But then the second question we hear sometimes is, I just don't understand why they're not taking advantage of it. And what we see is, again, it goes back to cost. While they're happy to have access to care, they just can't afford the premiums. They can't afford the costs out of pocket. And even if you're paying half of those premiums, we still see that. If you look over on the right, we've got 70% of employers say they pay more than half of employee premiums. And about almost half of them think that the employees are getting preventative care when a lot of times they're not. If you see the reality below, just shy of 70% say that, this is the employee speaking, access to care affects job retention for sure. But 40% skip needed care, and 18% last year spent $2,000 plus on out-of-pocket costs. It's a lot of money. What we will see, the thing they will skip the most is dental vision, 48%, right? That feels like something that's a lot easier to put off. Oh, maybe I could do that every 2 years until something hurts, right? The primary care appointments, their annual physical, making sure that, things are just working correct. About 38% are skipping that. Diagnostics tests, all your, blood work, lab work, things like that, 32% skip that. And interestingly enough, only 23% are skipping their mental health visits. What we've seen over the last couple of years, especially since COVID, is a lot of these mental health has been a tremendous, tremendous benefit. Our own usage at Vitable has gone through the roof, and people are really leaning heavily here. So when you put yourself in your own position of what care expects to see an ROI, well, we say about 40.4% of people are likely or very likely to adopt alternative models, such as direct primary care or ICHRA-based coverage, which is individual choice plans. But unfortunately, only about 18% of people really understand these structures. What we have seen in the last year, especially over these last 4 or 5 months, as people have looked at 2026 and they have seen massive increases in premiums, probably one of the largest premium increases years on record. I have talked to some companies that have had 40, 50, 60% increase in healthcare costs. Crazy. We have had a lot of questions about subsidies. As we saw, a month ago, 2 months ago, we had the government shutdown. One of the biggest things on the table was these subsidies where under ACA, employees had access to go and government would give them some assistance on their healthcare. And that has been a question of, is that going to go away or not? Right now, we have a temporary Band-Aid in place, but that is still a question that's on the table. And everybody's still a little unsure about what will the state of subsidies in healthcare be as we move forward. And what's happened from the employer standpoint is we've seen people begin to think differently about healthcare and start to say, okay, maybe the group health plan that I've traditionally had is not the option anymore. And maybe are there other things out there? Are there different combinations of things that I can piece together? That would eliminate, as you can see below, the unpredictability, the employee adoption, and lack of information that they feel they don't have. Those employers are trying to get people to return to work quicker, about 80% of them, not surprising. They want people to utilize the benefits they've got. They really want them to take advantage of that preventative care, and they desperately want to keep them out of the ER and those urgent care situations. And so we've just heard a lot about what else could we do? How do we approach this differently? We know that if we can get them into better plans, that retention and loyalty, as we said, is going to improve. Healthcare is now as influential as wages when it comes to retaining your workforce, and that's only going to get stronger over time. If we can, as you see below, remove 4 days of lost work every single year, if we can take the other three for the health related issues, the presenteeism metric there that you see, that's really interesting. It's 2.15 days a year where the employee is actually showing up to work, but they're sick, right? They're not doing a great job. They're out of it. They should probably be home. We lose about a week every single year to that productivity impact. Let's take the example of 10 employees. Let's say you have a 10-person business. That's 50 days lost per year. And with a 10% improvement via having better access or preventative measures, hopefully we recover, half a day recovered. Now you've got 5 days back. If you could get to that 1 day improvement, you've got 10 days back. This really is impactful over time. And not only that, that employee stays longer. So if you look at that turnover impact, 70% of people will stay at a job due to healthcare. You'll often hear people say, well, I need to stay there. I need my healthcare benefits. Very, very impactful. So shifting a little bit to what does that future look like? What we are seeing, and I kind of started getting into this, is it's not going to hinge on traditional insurance. There is going to be a massive move that is driven by access innovation. And we also believe that what's going to happen is we're going to see a lot of employees demand more choice. Current state, employer goes out, they pick that health plan, they figure out how much they're going to contribute to it. They give it over to the employees. They say, here's your pick, right? You can pick from these three plans. One's a high deductible, one is a PPO, whatever it is. And the employee looks at it and says, okay, well, I can or I can't afford this. Or these plans cover what I need or they don't. And they will either opt in or out. They still might not use it. There are a bunch of different vehicles out there that can actually contribute to putting more of this choice in the employee's hands. And if you think back to, the age of pension plans versus 401k, it used to be company would provide a pension plan. That company would decide where the funds were going to go, what was contributed to it, and then the investment selection. When 401k came along, it put that control into the employee's hands. It's now their account. The employee picks the funds that are going to go into it. They pick what they want to contribute to it. And all the employer does is determine a fixed contribution that, they're going to give to that employee either maybe once a month or when they get to a certain amount, maybe they'll match it. What we're seeing is a shift to that for healthcare. Catherine kicked off by talking about ICHRAs. These are individual coverage HRAs. And what an ICHRA is us as an ICHRA administrator, what we do is we connect employees with basically every single off-market plan that's in the market. And so where you might be able to offer them 3 plans under the same carrier, that ICHRA might open them up to 75 different plans in a market. They can go in and shop all of those and determine, okay, this fits me geographically. It fits me I can search my doctors. They're covered here. I can search my medications. These are all covered. This is a plan that is really tapered to my needs. And all you are doing is giving a fixed contribution into a tax-free account that the employee can only use to go spend on a premium first. And if there's extra left over, they can either go buy something medical related or it comes back to you at the end of the day. There's 2 very popular models of this. One, that ICHRA. The other is that QSERA. Very similar, just a little bit structured differently, but it gives very flexible alternatives. There are state level incentives for these employer funded primary care models. And the other thing we're seeing a lot is obviously after COVID, the rise of telehealth and virtual care as a path to get that preventative care up front. Especially for hourly workforces where, I don't know about all of you, but it is not my goal in life to take a day off work to go sit in a doctor's office for an hour, wait for the doctor to finally come out, an hour after my appointment is supposed to start, go into the patient room, wait another 30 minutes, come out, have blood and lab work that I have to go figure out how to get taken care of, maybe take another day off work. I've got medications that are given to me that I've got to figure out how to get delivered. And oh my gosh, this one's really expensive. And oh my God, this one needs a prior authorization. And I mean, you all have seen it. It's a wild, wild experience. And that's why we're seeing a lot of that rising adoption of virtual care where, again, maybe it's a single mother who's got a sick son. They can quickly get on a call, show their son on that call. They get whatever medication they need to get them through the day. That person's still going to work. And we're seeing a lot of policy attention to this in the government on small business health equity at both federal and state levels. One of the big pieces of legislation that was on the table as we went to 2026 was a lot more support for these individual plans. And a lot of that's still being worked through today. But again, kind of reviewing that, we see a lot of this power being turned over to the employee, which is great. So key learnings overall. If we think through all the stuff that we've taken out of this survey, again, cost barriers require new models for this type of employee. Small business workers aren't skipping care because they don't value it. They just can't afford it. And again, this drives them to the clearest path of getting things taken care of, which is the ER, unfortunately, and not getting the preventative care they need. Preventative care is definitely the best option to making sure that we are getting ROI back on healthcare. If we can get people into these programs early, pays off tremendously, avoids big claims, like it says here, I like the line, every missed screening is a future expense waiting to happen. That's terrifying, but it's true. And then that productivity depends on access to care. Without that productivity, it quietly drains small business of about a work week every single year. For some that have more chronic conditions, it's even heavier than that. But ideally, this reduces burnout, builds consistency across teams. Uh, we talked about the loyalty and retention factor. Again, mental health has become so large, but it's been very difficult to access, right? Everybody wants it. It's very expensive to get. A lot of insurance doesn't cover it, and they're stuck, but they need it. That stress and burnout, or it's like we've never seen. It's an epidemic. So, how do you integrate that basic behavioral health support into that primary care? And then, how do you make all this easy? How do you give them the ability to really just unlock this, make it simple, so they actually use it? So, if you're thinking about from your standpoint, what do I need to make sure I'm covering? I think this is a really good checklist to help you do that. One is I would audit your access and not just coverage, right? So I can put myself in your shoes and understand how much you're doing day to day and just how tough it can be. And then, when you get to that end of year or whenever your benefits renew, it is, okay, I've got to go and gosh, I got to go and, analyze these plans, figure out, does this make sense? Go through this whole thing. It's exhausting. But there's another part that you might be missing, and that's, are they actually using it? And if they're not, why? So I'd take some time to audit that access and make sure that, yes, you are checking a box in healthcare, but is it actually working? Think about new solutions, right? One that we talked about, and obviously selfishly, it's one that we do, is can you stack that primary care, right? Like virtual primary care, one of those, on top of an individual choice plan to give them the quick and easy access they need virtually, but then also give them the support they need if they really want that full healthcare coverage. They can opt into both and probably save themselves a lot of money doing that. Make sure that primary care gets stood up first. Give them options, low, no cost, virtual, anything you can do to make sure they're taking care of themselves preventatively, along with annual checkups, screening, vaccines, all these different things that can really help them. Test it out on your highest turnover if you've got that. Let's see what that does for you. And then really trying to figure out how this works and is it valuable for you. Monitor those return to work times, ER and urgent care visits, preventative visits. You can track those with your providers. Make sure they've got options that are outside of work hours. Catherine and I were just joking right before this. We hopped on where it's like, why are doctors only open 9 to 5? And in my head, I'm like, 9 to 5? Mine are open like 9 to 11. Then they take a 3-hour lunch break and then they're done at like 2 or 3. It's like nearly impossible to go see them. Review all those plans quarterly. Get your mental health taken care of through your primary care. But then really as you get into benefit season and you're rolling these plans out, how do you make sure you communicate it as clearly and effectively as you possibly can? You do all this, you are like a 5-star employer. Like this is incredible. Some of you might already do this. I give you massive kudos. But really, getting to this level is difficult to do. And Catherine, I think I am good. So we could either open it up to questions, or if there's none, we could let
Yeah.
everybody go.
Thank you so much for going over this. Yeah, so if you want to type questions in our Q&A or in our webinar chat, please feel free. I do have one question for you, Brendan, which is just given what the index reveals about rising costs and skipped care, what, in your opinion, is the biggest opportunity for employers to meaningfully improve access without overspending?
Excuse and Kevin, sorry, you cut out for 1 second. I heard, given what the index shows, what is the biggest ability for employers to improve? Is that what?
To improve access without overstraining their budget or overspending.
Yeah, yeah. It's so a couple things. One is it depends on what the access you're looking for is. If it is, simple access just to go see a doctor. I don't know about you, but you will get health insurance. You go through the health insurance listing that you with the carrier you've got, It says, hey, these are all the doctors in your network. And guess what? When you go and you call those doctors, a lot of them say, we're not taking new patients, or, oh, no, I'm not on that carrier anymore. I stopped taking that coverage. It's very frustrating. And so, yes, you might be able to find a very general doctor in there. But when you get into the specialist or like anybody that's going to do some extra work, it's really hard. And it might be somebody that's like 30 miles away. And when we go back to that missed productivity thing, it's like, if I have to add an hour drive on top of this is really painful. And so I think the best thing we can do is, virtual care has really democratized access, meaning, virtually you can go and talk to a doctor that's wherever. It doesn't matter, right? They still have the same credentials, they still have the same, um, you know, ability to diagnose and take care of people. But it's a heck of a lot more instant. You get things resolved quicker, and you don't have to go do all of this work to try and scrub a provider's website of who is right and who is not. So I would say, access to care, the advances we've seen in virtual health has been awesome.
It's great. It doesn't look like there are any other questions. So thank you for taking us through this, Brendan, and what for all the learnings. And we appreciate everyone who attended this morning or this afternoon, depending on what time zone you're in. We will share a recording and the presentation with everyone. So thank you everyone for your time.
Yeah, and if you have any other questions, I'm Brendan at Vitable Health. Feel free to ping me, or you can find me on LinkedIn. Willing to do that. But thanks for spending the time with us today, and we really appreciate it. Thanks, everybody.